In 1972, a man named Peter Buxtun leaked a set of documents to a reporter at the Associated Press. Buxtun was a former Public Health Service employee who had been raising concerns about a particular government program internally for years. He had written memos. He had raised objections through official channels. The response, every time, was that the program was scientifically valuable and would continue. So he went to the press. On July 25, 1972, the story ran in newspapers across the United States. The headline described a 40-year government study in which hundreds of black men in Alabama had been deliberately left untreated for syphilis so that doctors could observe what the disease did to the human body when allowed to run its natural course. The men had not been told they had syphilis. They had not been told they were part of an experiment. They had been told they were receiving treatment for bad blood. The program had begun in 1932. It was still running when the story broke in 1972. 40 years, 600 men, and a government that had watched, recorded, and published the results while the men got sicker, went blind, went mad, and died. To understand how this happened, it is necessary to understand the context in which it began. In 1932, the United States Public Health Service launched what it called the Tuskegee Study of untreated syphilis in the Negro male. The name, in the bureaucratic language of the era, described the program with clinical precision. It was a study of untreated syphilis in black men, conducted in Macon County, Alabama, one of the poorest counties in the United States, where the majority of the population was black and where access to medical care was essentially non-existent for most residents. The stated justification for the study was scientific. Syphilis was at that time a major public health crisis, particularly in rural southern communities. Some medical researchers believed, without strong evidence, that syphilis might progress differently in black patients than in white patients, based on crude and racist assumptions about physiological differences between races that were common in American medical literature of the period. The study was designed to test this hypothesis by observing the untreated progression of the disease over time. The men enrolled in the study were recruited from the local community through a combination of inducements that were significant for men living in conditions of extreme poverty: free medical examinations, free meals on examination days, free transportation, free burial insurance. These were genuine and meaningful benefits for sharecroppers and farm laborers in Depression-era Alabama who had no money and no access to doctors. They were not told what they were actually being enrolled in. The 600 men were divided into two groups. 399 had latent syphilis. 201 did not and served as the control group. None of them were told that the study's central purpose was to observe the effects of untreated syphilis by withholding treatment from the infected group. The word treatment in this context is important. In 1932, when the study began, there was already a treatment available for syphilis. It was not a perfect treatment. It involved arsenic-based compounds and was difficult to administer and not without risk. But it existed. The study was not designed to find a new treatment. It was designed to observe what happened to men who received no treatment at all. The study's architects expected it to run for 6 to 8 months. They wanted to observe the late-stage effects of untreated syphilis, the cardiovascular damage, the neurological deterioration, the ultimate progression to death. 6 to 8 months was long enough, they believed, to collect meaningful data. It ran for 40 years. The justification for continuing it shifted over time. Early researchers argued the data was still valuable. Later researchers argued that the study had been running long enough that stopping it would waste everything collected so far. Bureaucratic momentum. The simple institutional inertia of a program with its own staff, its own budget line, its own published papers, kept it alive long past any reasonable scientific justification. The most critical moment came in 1947, when penicillin became the standard treatment for syphilis. Penicillin was safe, effective, and broadly available. The discovery of penicillin effectively ended syphilis as a major public health threat for the patients who received it. The men in the Tuskegee study were not offered penicillin. The study's administrators actively worked to prevent the men from receiving treatment elsewhere. When men were drafted during World War II and required to be treated for venereal disease before entering military service, public health service officials intervened to have the Tuskegee study participants exempted from the requirement. When local health drives offered syphilis treatment in Macon County, the study participants were not enrolled. They were kept sick, deliberately, as a matter of documented policy. The person who made the program possible on the ground, who maintained the trust of the participants and facilitated their ongoing participation for decades, was a black nurse named Eunice Rivers. Rivers was employed by the Public Health Service and stationed in Macon County throughout most of the study's duration. She knew the men personally. She drove them to appointments, delivered their medications, which were not antibiotics but vitamins and iron supplements given to maintain the appearance of treatment, and maintained relationships with families. The men trusted her. The community trusted her. Rivers later gave testimony, explaining her understanding of the situation. She stated that she had not believed the men were being harmed, that she had understood the study as a form of ongoing medical surveillance that provided real benefits, including the burial insurance, which she characterized as a significant practical benefit for families who could not otherwise afford funerals. Her role has been analyzed extensively in the decades since the study was exposed. She was herself embedded in the same structural conditions that surrounded the participants, a black woman working within a white-dominated institution in the segregated American South, navigating constraints that were not of her making. The moral weight of the study's continuance rests primarily and overwhelmingly with the white medical officials and government administrators who designed it, maintained it, and refused to end it across multiple administrations and multiple decades. During the 40 years the study ran, the results were not hidden. They were published. Papers based on Tuskegee data appeared in peer-reviewed medical journals throughout the 1940s, 1950s, and 1960s. The study was presented at medical conferences. It was known within the Public Health Service and within the broader American medical research community. It was not a secret program in the way that MKUltra was a secret program. It operated in the open, in the published literature, visible to anyone who read the journals. This is one of the most disturbing aspects of the entire story. The experiment was not conducted in the dark. The American medical establishment, or at least a meaningful portion of it, knew what was happening in Macon County, Alabama, and produced no significant organized opposition for 4 decades. Peter Buxtun, the man who ultimately brought the story to the press, was not a senior official. He was a relatively junior employee who encountered the program and found it morally intolerable. He raised objections in 1966 and again in 1968. A committee convened to review his concerns concluded that the study should continue. Buxtun eventually concluded that internal channels were not going to produce change and went to the press instead. When the story ran in July 1972, the public reaction was immediate and intense. Congress held hearings. A committee was convened. In 1973, a class action lawsuit was filed on behalf of the study participants and their families. In 1974, the government settled out of court for $10 million. The settlement provided lifetime medical benefits and burial services to all living participants and to infected wives, widows, and children of participants. Of the original 399 men enrolled with syphilis, 28 had died of syphilis directly by the time the study was exposed. 100 had died of related complications. 40 wives had been infected. 19 children had been born with congenital syphilis. These are the numbers from the formal records. The full human toll, across 4 decades of a disease deliberately left to progress in hundreds of men, was larger than any formal accounting could capture. The consequences of Tuskegee extended far beyond the men in Macon County. The study's exposure produced a lasting and measurable impact on the relationship between Black Americans and the American medical establishment. Research published in subsequent decades documented significantly lower rates of trust in medical institutions and lower rates of participation in clinical research among Black Americans compared to white Americans, with Tuskegee cited explicitly by survey respondents as a reason for that distrust. This distrust had and continues to have real public health consequences. Lower participation in medical studies has limited the availability of health data for Black populations. Lower trust in medical institutions has been associated with delayed treatment seeking and lower rates of preventive care. The harm of Tuskegee was not contained to the men who participated in it. It radiated outward through generations. In 1997, President Bill Clinton delivered a formal presidential apology to the 8 surviving participants of the Tuskegee study. The ceremony was held at the White House. The survivors, by then elderly men, sat in the front row as the President of the United States acknowledged on behalf of the government what had been done to them. The apology came 65 years after the study began. 5 of the original participants were still alive at the time. The last known survivor, a man named Ernest Hendon, died in 2004 at the age of 96. In 1974, partly in direct response to the Tuskegee exposure, the United States Congress passed the National Research Act, which established the requirement for informed consent in federally funded research and created the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. The Belmont Report, produced by this commission in 1979, became the foundational document for research ethics in the United States. Its 3 core principles, respect for persons, beneficence, and justice, are taught in every medical school and research institution in the country. The framework that governs how human beings are treated in medical research today, the requirement that participants be told what a study involves, told what risks they face, and given the genuine choice to decline, exists in its current form in large part because of what was done to 600 Black men in Macon County, Alabama, between 1932 and 1972. The Tuskegee Institute, where the study was named but which was not the institution that ran it, changed its name to Tuskegee University in 1985. The Bioethics Center at Tuskegee University now runs programs specifically focused on building trust between the medical research community and communities of color. The former site of the study in Macon County is not a museum. There is no monument at the location where the men were examined, where blood was drawn, where the progression of their untreated disease was recorded and filed and published. The men who were enrolled in the study were recruited because they were poor, Black, and living in a state and an era in which they had no power to refuse a government program. They trusted the government because they had no particular reason not to. They were given that reason. Most of their names appear in the historical record only as case numbers.